Probably words you don't want to remember. Lockdown, social distancing, quarantine. Those concepts weren't widely understood 5 years ago when the world was hit by the coronavirus pandemic. COVID-19 killed around 7 million people worldwide. Well, fast forward to the present day, and one thing is clear. Preparing for the next global outbreak is vital. That's what the World Health Organization is doing. Member states have formally adopted the first global pandemic agreement. The legally binding pact is expected to enhance the world's collective ability to prevent and respond to future events. It outlines principles and tools to ensure equitable access to vaccines, treatment and diagnostics during health emergencies. The agreement aims to bolster international coordination, but it also reaffirms national sovereignty. The WHO has clarified that it can't impose domestic policies like lockdowns or mandatory vaccinations. Well, we can go to the English city of Bath and speak to Dr. Bharat Pankania, Senior Clinical Lecturer at the University of Exeter. Doctor, it's always a pleasure to have you on, but we're always talking about things that threaten humanity, you and I. It's about time this happened, right?
It is, absolutely, and good to see you, Adnan. It is a step in the right direction. Whilst we are aware that the United States of America wishes to step away from the World Health Organization, this accord, this global accord, whereby all nations, all member states of the World Health Organization pledge to do good for all countries, particularly focusing on the vulnerable ones, is a step in a very, very good direction.
What do you think would have happened if this sort of global agreement had been in place at the start of the coronavirus pandemic? We spoke very often, and you were always pushing this issue of equity between the North and the South, the East and the West, the rich and the poor.
So we would have had a much faster resolution, and more importantly, Adnan, save lives, all human lives matter. So we both know that when Pfizer and Moderna made their vaccines, the rich nations bought up all the stocks, and then South Africa could not get any, nor could Africa for that matter. And then what happens is that variants, which can put you back many steps, start to emerge from the countries where they have infections which are not being controlled because they haven't got, for example, the vaccines. So being fair is also looking after your own backyard when you do that.
How important is American money and scientific knowledge to these collective global efforts towards healthcare?
It is very important because the United States of America excels in research and development. It is a big funder of World Health Organization, as well as a funder of innovative medicines and medical programs, logistics. So we will miss the United States of America if it stays away from the World Health Organization. Having said all that, there is considerable resilience in the World Health Organization, and we mustn't say we are a sinking ship just because the United States doesn't want to play. The European Union, the Far Eastern countries, are, as members of the World Health Organization, are still there, and they're doing a great job.
There was one particular word, one particular issue during the height of the coronavirus pandemic, and that was lockdown. Do you think now the governments in the next pandemic, because surely one will come, it's just a question of when, that they will lock down much more quickly because they have understood what happened during COVID-19, and they'll understand, yes, they'll take the economic hit, but it will be worth it?
Well, a short, sharp, quick, prompt action is what saves the day, and failure to act fast and swiftly results in a persistent, prolonged lockdown, as happened in the United Kingdom. And what is really important, Adnan, is to have governments get that message across, which is, if we enter into, inverted commas, lockdown territory, it is for a short, sharp, rapid action and resolution. It mustn't be that we're going to have a prolonged, non-specific lockdown, indeterminate for years on end. So that messaging has to get through very succinctly by the governments. Otherwise, the population will not obey.
Senior Clinical Lecturer and Deputy Mayor of Bath, Dr. Bharat Pankania. Thank you so much, Doctor.
You're welcome. Thank you.